Welcome back to the Noon Show on WBAY TV2, and welcome to Ask the Expert. Dr. Kurt from Tower Clock Eye Center is with us today. Good to see you again, Doctor.
Thank you. Good to see you.
Let's talk about glaucoma. You have been serving this community at Tower Clock Eye Center for 30 years, over 30 years.
Right.
And over the years, have you seen in maybe one area more developments than in the glaucoma area?
Well, sure. I mean, as a glaucoma specialist, we see new developments come along frequently, and we have a lot of options available for treating glaucoma patients, fortunately. We've got a lot of good medications, we've got laser treatments, we also have a good range of surgeries to choose from. Lately, there haven't necessarily been a lot of changes with regards to medications or laser, but from a surgical standpoint, there are a lot of good options that have come around in the past 5 years or so. And actually a lot of even newer ones on the horizon that are allowing us to provide care for patients and reduce their eye pressure, treat their glaucoma without having to resort to more and more medications.
And one of those options that you offer is called iStent. Can you tell us what that means and what that is?
Correct, yeah. So the iStent is a tiny device. It's less than 1 millimeter long, very, very small. It's actually the smallest implanted medical device in the world. But it's made out of titanium, and I tell patients it's like a little snorkel that gets put into the drain inside the eye at the time of cataract surgery to help fluid in the eye bypass the clog in the drain and leave the eye. So currently the iStent is only approved for use in conjunction with cataract surgery. It's possible that in the future it'll be approved as a standalone device, but it's really allowed us to help patients who are having cataract surgery who may also have glaucoma and help them to reduce their eye pressure, maybe decrease, or in some cases eliminate the medications they have to take.
Oh, that would be fantastic.
Yep.
So how does an individual know if they are a good candidate for this or a candidate at all for this?
You know, just about anyone having cataract surgery who has glaucoma is going to be a candidate for iStent. There are some particular subtypes of glaucoma where it may not be appropriate, but for the vast majority of patients, it's a reasonable thing to do, and they're likely to see some benefit.
What's the best way to get a hold of you if folks have any questions, want to talk to you, and maybe set up an appointment?
Well, really just a phone call works. We have website forms that can be filled out. You can ask your current eye doctor to refer you to us, but there are a number of channels for people to get in. We like to leave the door open, help as many people as we can.
Walking through that door at Tower Clock Eye Center with Dr. Curtis is as easy as following the information right on your screen. It's always available by going to WBAY.com and clicking on Ask the Expert as well. We'll get you back into the Noon Show here on WBAY TV2 right after this.